we're going to talk about, how to apply for a public health graduate role in a local authority. So I'm Stacey Gunther. I'm one of the service leads in the public health team in Birmingham City Council. My remit at the minute is around mental health and wellbeing, suicide prevention and justice health, and I have a team that work alongside me to deliver work in those areas, of which I also have a graduate post that we've recently recruited to. I'm sure many of you will have seen that at Birmingham City Council we do have quite an extensive graduate programme, and that's why we've decided to do this webinar today. So before we get started, if you all want to make sure you're muted and maybe turn your cameras off so that the screen's the main thing that people can see, and we can move forward from there. Thomas, who is the other name on the slide that you'll be able to see, is our head of office. He's currently stuck on a train at the moment, travelling between meetings, but should be joining any minute now. And once he does, he will just join in, but I will start in the meantime for you all. So just in terms of what we're looking to cover today, we thought a quick overview of Birmingham City Council, why Birmingham City Council, a sort of a touch on local authority, public health within the City Council, and then provide some information about graduate opportunities, and then talk a little bit about details of how you might find adverts, and then sort of how and where you might apply, and run through some of the things that we've observed that might help you with applications going forward. So hopefully those of you familiar to Birmingham will recognise the screenshot, which is what I see whenever I get the train on into New Street. And there's all the HS2 work going on in front of that. But that aside, Birmingham is an incredibly vibrant, super diverse city with so much opportunity for all of us working within it. The City Council is the responsible body for the governance of the city of Birmingham. We work every day to make a difference to the citizens and our populations and communities and really improve the lives that they can live, and the different things within the city that will benefit people. A key stat really from the census here, we're the youngest city in Europe. 40% approximately of our population's under 25, so that creates really good opportunity in terms of vibrance and places for young people to live, but also such a spirit and opportunity for us in terms of improving health and well-being. So our public health division, those of you who've had any look at our public health division will probably realise that we're quite a big division. We have lots and lots of work that they work on, which wouldn't be surprising for the size of our population. But we make sure that we really do, in line with our specialist public health skills and knowledge, that we really do deliver evidence-based public health interventions and approaches that are all about reducing health inequalities across Birmingham, really just to improve the lives of our citizens. There's sort of three domains to public health that we work across, so health protection, health improvement, and healthcare public health. All of our work slots within those, but there's so many different pieces of work that go on within the City Council. So, for example, we do health protection response to outbreaks. We have our sexual health work. We have our fast track cities work. There's lots of work going on with our communities team around community health profiles. A big inequalities stream of work that works on projects such as Black Year that you might have heard about. We have the food revolution. We're just developing a framework for action for public mental health work. There's absolutely loads going on, and it's a really good opportunity to get involved in lots of different pieces of work and work across the council as well with other departments and colleagues that can make a real difference. Probably those of you that have just studied an MPH as well will recognise the model on the right, but that just sort of spans the breadth and domains within public health. So moving on to career progression and posts that we have within our City Council, I'm sure most of you will appreciate that there is a career pathway, and this is how it works in Birmingham. So we have sort of entry-level roles around public health officers and public health graduates. We have public health officers, which tend to sort of lead or work on specific pieces of work. We have senior officers that take more autonomy and lead work. We have service leads who manage wider, broader areas of work, like I just described at the beginning. And then we have training posts that work up to our consultants and assistant directors, which are qualified public health consultants, and then all underpinned by our Director of Public Health, who has overall statutory responsibility for the public health grant and the work that we do. We all work to improve our skills in line with the knowledge and skills framework, and make sure that we really are adding value and public health expertise to anything that we work on and any partnerships that we work on with others, whether that be internally in the council or with other partners outside of the council. And partnership working is absolutely key to everything that we do. You know, we can't do everything on our own, we realise that, but what we can do is have the reduction of inequalities in the best interests of all of our in communities at the heart of everything that we do and every conversation that we have. So, in terms of sort of what we would do and how we would support graduates, there are various opportunities that you can take up and maximise on if you. Sorry, Thomas joining is absolutely throwing me. It's good to have you join us, Thomas. I have explained you got stuck on the train. So in terms of skill development, there are various opportunities throughout your time as a graduate at BCC that we really could help you with. So there's the Public Health Development Programme, which enables you to develop skills outside your area of expertise. So you might be in a post in one team, but that doesn't mean to say everything you do will be within that team. You can work across and develop gaps, fill your gaps and develop new skills and new competencies. Work with professionals outside of public health, which is what I was just talking about the importance of partnership. There are specific training courses to public health, so the masterclass course, for example, organised by Health Education England, but there's also specific courses around project management, things that we would encourage graduates to do to enhance their skills to be able to move forward in public health. And then there's obviously volunteering opportunities that we actively involve people to be involved with as well. So this is where I now see if this will play. So we've had over the last few years quite a few graduates come through and join the division and benefit from working with us. And this is a story of Claire, who's still with us in the team, not as a graduate. She's got a substantive post and doing some brilliant work. But this is Claire's story about coming to our division and how she's found it, really. And hopefully it's going to play now. I think we're getting there slowly but surely. For any of you who aren't used to working online professional meetings, the circle of spinning wheel, waiting for things to load has become a norm. 3 years ago, I think it used to panic all of us. It is not responding. I'll give it one more go, and if it doesn't work, we'll move on and I'll load the web page separately and we'll share the story at the end.
Yes, so we are going to share our link tree with you shortly, and you'll be able to watch a number of videos from a number of our graduates, from reflecting on their time as a graduate, and then we've got further videos like Claire's story that brings to life what that graduate role has meant to their career in public health and here in the council as well.
I don't think it's going to load, so I think we'll carry on and we'll share the link at the end. Well, it's there anyway, and you can watch all of the stories that are on there. So moving on, don't know if you want to do this one, Thomas?
Yeah, so there are a couple of graduate schemes that are available within the council, and we wanted to mention both of them because they both give you an opportunity to work within public health. So I'm going to briefly touch on the one on the right hand side, which is the National Graduate Development Programme, and that is council led. It's a 2-year programme and you do 4 different rotations. The application process has closed for this year, but bear it in mind for next year. The intake, it finishes in February, but the final placement, you get to choose where you are placed, and one of those can be in public health. And we have a great success story. One of the candidates that is now a service lead started on the graduate program there, came into public health, really enjoyed it, and has stayed as vacancies have arisen. But on the left hand side, this is partly part of my remit. So I am head of office for the Director of Public Health, and we have a passion for bringing in new talent. So the public health programme is a 12-month fixed term contract. It is for those people who have a public health background or has a degree or preferably a master's in public health or relevant discipline. And what we do is we align each of the graduates to a assistant director, director, or a new deputy director post. And they work across a portfolio, like Stacey explained earlier, to get you as much exposure to the public health work that we do, and align that across the public health skills framework. In your supervisions, and we'll go into shortly, the support that surrounds the graduates, you get a portfolio of work that enables you to look at the skills that you need in terms of the framework and work towards that practitioner status with the UK Public Health Register. And then and we'll talk through shortly about progressing through then onto the specialist register. But it does give you that formative experience at being able to apply what you've learned and put that into practice in the largest council within Northern Europe, and also we are the largest public health department within the UK as well. So as I said, this is taken directly from the job description, and we use this in our advert. So it's for people that have recently graduated with a degree in public health or equivalent relevant degree level qualification, and it will give you the formative experience in applying that learning in a dynamic public health department. Public health here in Birmingham is a very diverse department. We come from lots of different disciplines. There's lots of matrix working, and that transfer of skill and knowledge is really important and something that we use to help strengthen our team, but also helps with our succession planning. And we line everything we do across the public health skills and knowledge framework, which I think Stacey will go into in a little bit more detail. And every single graduate has a portfolio of work that is absolutely core to the delivery of our objectives and aims for the year.
So in terms of the job description and the personal spec, on the screen you'll see there's some screenshots. Don't know whether you'll be able to zoom in enough to be able to read the detail, but all of our jobs at the City Council and lots of other local authorities have a job description and personal spec. These are really key when it comes to applying for jobs. It's really important to have a really good read of the what's in the job description. There's usually a bit of information about the priorities of the organisation and the specific parts. So in this case, public health and what we're out to do, what we're about, what our key functions are. And that detail gives you a bit of information about what we're doing, whether that's right for you, whether that's somewhere that you would like to work, whether your values sort of align. There's also, for most organisations, lots more information on their website, so it's worth having a good look to check out sort of the place you're applying and find out what their priorities are, and then trying to reflect that in any application that you make. It's really key, and I think this is stressed through the next few slides. So I'm going to mention it here for the first time, but it's going to be mentioned definitely more times. At Birmingham City Council, we can't accept CVs. So if you're going to apply, you need to do a written supporting statement to go with your application. And that's your opportunity to tell us about you, to tell us about the knowledge you've got, how you got that knowledge, how it applies to the personal spec and the job description, and also what experience you have. What have you done within those things? And we fully appreciate for these roles that they are graduate roles. We're not expecting people to have 10, 15, 20 years of public health experience, but everybody has something that they can write about to bring together these points. So just really think about what you've done. And, for an example, might be something around time management. If, for example, you've been studying from MPH and working as well and juggling something else outside of that, all of that, that really does show skills in time management, and it's how you use that example and articulate that in the form. So don't worry if the examples you have aren't specifically work related. Try and bring together to life the things where you do have examples, because it really helps you with an application, basically. And you have to think about it this way. We want to give everybody a chance. And the more you write, the more relevant stuff you write. I'm not encouraging you to write 50 pages of text just for writing 50 pages of text. But the more relevant stuff for job description and personal spec that you write, the easier it is for us to shortlist and give you an opportunity. And that's ultimately what we want to do. So what else is on the slide? Top
So
tip. Go on.
Could I just come in there?
Yeah.
So what I would say is we construct panels that start at the beginning of the process and end when somebody is appointed. Generally, there's 3 people on that panel, and Stacey just touched on their shortlisting. So what we do is we look at each point and we look at what you have written and how you've brought that to life, and we look at the skills and the knowledge, and we have a matrix, and it's all done independently, and it's all read by the panel. There's no computers, there's no algorithms. We sit and we read every single word that you write, and every single word that you write is really, really important. So we would look at that, and we've got a matrix. And like Stacey said, we're not looking for everybody to have everything. When we're looking at it, we're looking at how it meets that function criteria and how you brought it to life. What happens then is we moderate that as a panel together to make sure that people are seeing the same things, and if there's any anomalies, then it can be moderated. It is a really fair and robust process. Every score is looked at, everything is moderated, and it all comes down to how you articulate yourself on that supporting statement.
Definitely. And the other point that just on the personal spec, you'll notice at the top of this, if you can see it, and maybe have a zoom in afterwards if you can't, that there's a method of assessment on there as well. So application form, interview, test or exercise, certificate and presentation. Everything that, obviously, that's how they're going to be assessed. So if it says application form, that's things that ideally, if you can, you need to get across on that application form.
The last thing I would say on that, and I think is on the next slide, so I'm slightly jumping ahead. Write something, because you do have the skills and the knowledge. We receive over 130 applications for the last 2 graduate posts that we've had, and it can come down to you not writing about a specific point because people don't think they have relevant experience, knowledge or skill. Have a read of the subject, research the subject, and talk to us about that. It could mean the difference between you being shortlisted and not being shortlisted.
So I think we've probably covered most of what's on this slide by Thomas and I talking ahead of our slide deck. But I think the key thing highlighted in bold, as I said before, is that we don't accept CVs. But really, I think the title of this, the importance of the supporting statement, this is the key thing for any application. Make sure you get across your points. Make sure you tell us what you can do and the experience you have. And that's, the thing that I would recommend spending the most time on when you're applying for a role. The other
Yeah.
thing I would say is, as Thomas has said, we get over 100, we get over 100 applications. That's a lot of reading. So set it out as clearly as you can and make it as easy for us to read as possible. I'm not saying we're not going to not read things, because we will do our best, but I'm sure you can appreciate what a lot of text there is to get through with that many applications. So make it easy for us.
So we've already partly covered this as well. So when you're filling out the application, like Stacey has just mentioned, when I applied to come and work for the council, I took all the AF points out of the supporting statement and I looked at each and every single one of those and I thought about examples in my knowledge, my skills and my experience, and I just noted them down. What I then did is I started to build up my examples and grouping examples together and parts of the person spec together where I could clearly write a really good, robust example. What I would say is by grouping them together, you need to make sure that your example absolutely does cover off every single part of that person spec. What we do see a lot of the time is when people group them together, it dilutes the example because it's really strong in some parts but not in others. Please, when you're thinking about your examples, make sure it covers all of the points. When we put it up on our website, WM Jobs, which again we'll come to shortly, it is for 2 weeks. It closes at a specific time and date, and it will tell you on that. It's generally 23:59 on the closing date. We can't accept any applications post that time, and you won't be able to post it online. Take your time. Generally, as I was the contact on the last graduate post, email them, ask some questions, ask for 10 minutes just to have a quick chat if you're uncertain about a few things. If you really want to understand the culture and the work ethic, have a look online, do some research, pick up the phone and ask those questions. What not to do is tick boxes or not answer any
Sorry, if you just want to
questions.
mute yourself, whoever that is, please.
I would suggest that we would need to look at where countries have been successful.
I think somebody's in something else as well. I'm just trying to see on the. That sounds better.
And absolutely what you write about, you want to be able to bring that to the interview as well. So absolutely make sure that what you put is what you can talk about and you can translate that. And with regards to your personal statement, your supporting statement, with your CV, a CV is quite subjective. It's what people's perception of that is. A supporting statement is exactly what you've written, is what we will use when we put it when we go through our scoring matrix individually. And your job history will not be marked as part of that. That's a big one. Just because you put it on your CV and you submitted it, what we would ask you to do is bring that to life during your examples. So it is very much about what you write. And we will not make any assumptions.
So, all of our council jobs are advertised in the same place to external candidates. We use West Midlands Jobs. So for those of you that aren't familiar with West Midlands Jobs, the web address is on the top left of this screen here, so wmjobs.co.uk. On there, it takes you to lots of public sector jobs, not just the ones at Birmingham City Council, but you can search for anything in Birmingham. So just put the location and put public health and search, and it will bring up a list of jobs that are available to apply for at that time. It's also worth, I know we're going to come on to our social media platforms at the end, but following us on social media, because generally when there is a role out to advert, we tend to promote them on Twitter, various other social media platforms, LinkedIn as well. So it's worth just having a follow if you're interested.
You can also set job alerts. So for those of you that are not ready to graduate yet and have got a year, 2 years, 3 years left, or however long on your degree, set job alerts for jobs that you're interested in and have a look at the person spec as they're coming out, because that will form some of the own professional development that you do, but also what you will see is what is kind of being asked for in terms of these jobs, but also you will get the first alert to say this job has gone live, and it gives you the most time you can and give yourself the time to be able to put an application together rather than checking sporadically. Set alerts for public health, Birmingham City Council, and they will pop into your inbox.
Yeah, and the other thing is when you do look at those JDs and personal specs, if you are planning in advance and you notice there's something really don't have, or there's a gap, there is opportunity to seek ways to fill that, whether it be education or whether it be actual application experience in terms of what you can do. There's always voluntary placements and things like that that might help you fill gaps as well. If you're not ready to apply, or you've applied a few times and not been successful, that might be something to look into. And it doesn't have to be with us. There's lots of other organisations where you can get that type of experience that might just help. Sort of setting yourself amongst everybody else, I guess. Oh, this is Thomas's slide.
So this is our link tree. So we have a team called Boulder Healthier, and they are our engagement team that look after the wider engagement piece in terms of health campaigns. But we also have on the right hand side, that is our link tree that gives you all of our social media, our events, newsletters, and various other promotions. Post this, we'll make sure that the slide deck's available. I'll get AN to get in touch and we can get you the link tree, so you can follow us on all those different mediums.
So questions. There's two ways we can do questions. You can drop anything you've got in the chat, or if you'd like to unmute and ask a question, that's absolutely fine too. I don't know whether now would be a good time to stop the recording of the webinar as well, possibly, if that's okay, Anne.
Yeah, no problem.
Thank you.